Malaysia has been forced to shut a vaccination centre after more than 200 workers tested positive for COVID-19. The incident comes as the country struggles to contain its biggest outbreak. It's reported 11,000 new cases. That's its highest daily tally so far.
Malaysia has ramped up its vaccination drive by opening mass centres like this one in Selangor. But it's now been forced to close after nearly half of its 450 workers tested positive for COVID-19. They were detected during a mass screening exercise after 2 volunteers were found to be infected. People who have visited since the 9th of July have been advised to self-isolate for 10 days. For others, appointments have been pushed back. But there won't be mass testing just yet.
This is the issue here right now, is to only test when you have symptoms. This is a basic principle in pandemic management right now. So we are extending the same principle to the case at IDCC, which is if you display symptoms which are consistent with COVID-19 after the 9th of July at IDCC, then we'll get tested.
The centre has been closed for a day so it can be sanitised. It will then be up and running again with a new team of workers. Despite a prolonged lockdown, infection rates remain high in Malaysia. Daily cases have hit a new record of more than 11,000. But there are pockets of optimism. Malaysia has one of Southeast Asia's highest rates of inoculation. 25% of its population has received at least one dose of a COVID-19 vaccine.
For more, Melissa Goh joins us live now. Mel, most of the infected workers at the vaccination centre have already been inoculated. Do we know what vaccine shots they received?
It's unclear what vaccines these frontliners took, but the Health Director General, Dr. Nur Hisham Abdullah, revealed that more than 2,700 healthcare workers, including doctors and nurses, have been infected, even though they were fully vaccinated. Now, Malaysia has Pfizer, AstraZeneca, and Sinovac in its vaccine pool, so it could be any one of them. But the good news is majority of them are stage 1 or 2 with either mild or no symptoms at all. Now, the viral load is also low from the tests. Chances are they won't get too sick and should be able to recover quickly. But the thousands of people who came in for the vaccination the past week, the irony is that they are now exposed to the risk of infection. Now, these vaccination centres in Malaysia, especially the mega ones, they are fully air-conditioned and they are quite enclosed, although they are big. Although everyone does adhere to safe distancing of at least a metre or so, but virus is airborne. Health Director General Dr. Nur Hisham also said that. So exposure to a prolonged period are bound to get infected, although most of them have been vaccinated. Still, faced with rising cases, Dr. Nur Hisham said ramping up vaccination is the only way out, although they are actively now adding more beds, more ventilators, buying more oxygen tanks, converting more hospitals to treat COVID-19 patients, and diverting resources from other states to Klang Valley, where I am, to ground zero. Let's listen in.
But this is not the solution. The solution is to decrease the cases. The only way we can decrease the cases is that to increase the vaccination rate. When we started the second phase and first healthcare workers, of the healthcare workers infected 2,779, majority of them category 1 and 2. So then you don't need admission to the hospital.
Malaysia's under lockdown, Mel, but it continues to see these record numbers of infections. When do authorities expect things to get better from here?
Well, if you speak with Health Director General Dr. Nur Hisham, he attributed the spike in new cases surpassing 11,000 now to the increase in mass testing from the usual 70,000 to over 120,000 tests today. So also the new variant, the Delta variant in Malaysia, has reported some 66 cases so far. They are a lot more infectious. The R0 that measures infectivity is 8. For Delta variant. So one infected can spread to 8 people within a short period of time. So And they also take longer to recover usually and progress to stage 4 and 5 quickly. So beds are always full. Also, patients are getting younger, Dr. Noor Hisham said, and that's because due to low vaccination among the younger group. But looking at the trend, the Director General said cases likely to continue to go up for at least 1 week or two. Vaccination, he said, remains the only way out. The only solution, a special task force for the Klang Valley has asked the Ministry of Finance for an additional budget of 1.2 billion ringgit. That's more than $240 million to beef up the healthcare system to buy time for vaccination to catch up. Right now, only 11% of the population have been vaccinated. The target is to vaccinate 80% of the population before year end. Also, no curfew, he said, is needed because the enhanced MCO right now is strict enough. If all were to do their part and adhere to the standard operating procedures. Now, the problem is enforcement. It all boils down to enforcement and the inconsistency when it comes to policy implementation in the country that's created a lot of confusion, a lot of resentments on the ground now as people are reeling from this protracted lockdown. Don?
Mel, thank you very much for that update. Melissa Go there in Kuala Lumpur.